Types of minimally invasive surgery we do for lung cancer run the spectrum here for doing minimally invasive procedures for biopsies, but we also remove parts of the lung with the scope, and we call those either VATS or minimally invasive lobectomies. And it's kind of a newer approach to take out parts of the lung without actually having to make larger incisions into the chest. The biggest advantages for doing the operations in this manner is that, one, we don't have to open the chest, so there's no cutting of the muscles on the outside part of the chest, nor do we have to cut or remove any parts of the ribs. The patients usually wind up with 3 or 4 small incisions that are 1 centimeter or 2 in size. In general, their pain control winds up being much, much better. Hospital stays tend to be shorter, and we're able to get the patients back to a better functional recovery in a quicker fashion. This, certainly allows us to extend, the ability to operate on people who have more advanced emphysema or other lung diseases, so that we're able to take out a part of their lung without opening the chest, because they're able to breathe better after the operation. They have less complications such as pneumonia, and again are able to go home sooner and then usually wind up getting back to a better functional recovery. Correct. The trend for patients who have more advanced stages of lung cancer in general is to receive a combination of chemotherapy and radiation as their initial treatment. Once they've completed that therapy, and especially if they've had a good response, then we're able to go in surgically and remove the part of the lung that has the tumor, and also remove the lymph nodes, which is usually the situation in that case. That sometimes can be done as a minimally invasive procedure. More often that's done as a more standard open operation, just because of the need to remove all of the lung tissue and the lymph nodes that are involved with cancer. But more and more, even those types of operations are being done in a minimally invasive approach. Nationwide, it's estimated that only about 10 to maybe 15% of all lung cancer operations are done as a minimally invasive approach. Part of that is surgeons' comfort with the minimally invasive procedures. Some of it has to do with the patient's anatomy and the type of lung cancer staging that they have. So all of that winds up factoring into it. I think as the next generation of cardiothoracic surgeons is trained, there'll be a greater familiarity with doing minimally invasive operations, especially in the chest. So I anticipate that as we wind up going forward, more and more of the lung cancer operations will be done as a VATS or minimally invasive lobectomy. There's been at least data that's been available for a number of years that doing the operations with a minimally invasive approach, and especially more of these are probably done with patients whose cancers are detected at an earlier stage, that in compared to what traditionally has been survival, when we're finding very small lung cancers and you wind up removing them with the scopes, there have been reports as high as 90 to 95% of those patients being cured, from their lung cancer, which is in comparison to maybe 15 to 20% of all comers. So there clearly appears to be an advantage in terms of certainly smaller incisions, but also in terms of survival from their cancers. Well, I think that, in comparison to, what we've been dealing with, over the years, and, patients with lung cancer, having a higher risk of dying from their disease, anything newer that we can wind up introducing that, improves survival, gets the patients home quicker, and then also winds up getting them to their other therapies, whether it be chemotherapy or radiation, is certainly encouraging in terms of being able to increase survival from this disease. I'm Dr. Rudy Lackner, a thoracic oncologist at the Nebraska Medical Center.